Hello, everyone. Welcome to my channel talking about residency interview. Thank you very much for watching my last video. And I have received a lot of encouragement and feedback to me as a new YouTuber, and I really appreciate it. That makes me feel that my effort is so much meaningful, at least to me, and hopefully to you as well. And the question I'd like to cover is a common question during a residency interview. That is, do you have any questions for me? And this question usually happens by the end of the interview. And less commonly, but it could happen, is that the whole interview can be letting us candidate to ask questions. So I'd like to cover 3 points in this video. That is what to ask, whom to ask, and how to ask. Before we go to there, let me ask, why do we want to ask questions? I think the simple answer is that we want to get an answer to clear our questions or concerns about a program. And I think more than that, by asking these questions, we sort of want to show our passion for the specialty and our interest to the program, the effort we made, and our personality that would fit the program. I think if we can show or demonstrate some of these by asking a specific question, it may help us to stand out during the interview. So I'd like to first of all cover the first question is what to ask. In other words, what are the best questions to ask during the interview? I very subjectively divided questions that we can ask into 3 tiers. I think the top tier of questions are from conversation. Those are like real-time questions from the interaction with the interviewer. I think that is important because it shows our close attention to the conversation. It shows our respect to the interviewer and our strong interest to the program. I think that is very important. For example, usually during the interview, the program director will likely give, first of all, an overview presentation about the program. And there they may offer some updated information from their website or some new information that is not covered from their website. And those are places I would be very interested to ask because those information are new to me. Also, I think asking questions from the conversation really help the interview to flow more naturally. That is also very important, I think, during the interview. So this is tier 1 questions, in my opinion. And the tier 2 questions are, I think, from the website. And there you can find some very specific questions related to certain, for example, unique features of the program you are interested in. For example, Mayo Clinic, when I looked at the program last year, I found from their website that they offer a leadership and management course that is very unique to me. I didn't find in other programs that I applied. So in that case, I would be very interested to ask how, for example, how the course is structured, how are residents evaluated after the course, and what are the potential opportunities for residents to practice leadership during the residency training. This is what I mean, tier 2 questions. Tier 3 questions in my mind are sort of more general questions from our preparation. That is not necessarily to be unique to one program, but can be applied to maybe multiple programs. But there are still strategies that can help us to ask these questions in a better way, which I will talk about it in a little bit later. So this is the first question I want to talk about, that is what to ask. The second point I want to cover is whom to ask. I think whom to ask is also very important. For example, I think it's perfectly okay to ask a resident, what is your favorite restaurant in town? However, if you ask a program director, hey, where do you really have dinner after work, that sort of sounds to me there is some space to improve. That is what I mean by whom to ask. I think for PD or associate program directors, we can ask questions, for example, related to their curriculum, about their rotation schedule, about their, for example, interest in case conference, journal club, what are the peer-to-peer learning or teaching opportunities. I think those are maybe good questions to discuss with the program director or the leadership. Sometimes when we ask a question of this type, the interviewer may answer like, well, that's a great question, but I think a better person to ask or who can answer a question is our program director. That gives me a feeling that maybe this specific interviewer is not involved very much in the leadership or the organization of the program. So they are less familiar with this type of questions. In this case, I think we may want to ask questions, for example, related to career development, for example, fellowship or research opportunities in their specific subspecialty that can help the interaction between ourselves and the interviewers. And last but not least, I think for program coordinator and the residents, we can probably ask questions related to their wellness program, for example, their extracurricular activities, if there are good gym or cafeteria in the hospital or in the town, what is the housing and the transportation opportunities, or what is a typical day as a junior or senior residents like. So those are questions I think we can ask for a program coordinator or residents. So this is the second point about whom to ask I want to cover. And the last point I want to cover is how to ask. So I sort of summarized here 3 strategies that I was using. First of all is provide a context. Second is share my thoughts. And third is show efforts. I will give an example about asking how many PAs in the program. Instead of directly asking how many PAs are there in the program, we can sort of provide a context and share our thoughts. For example, we can mention, oh, during my pathology rotation, one thing I really learned is that PAs are very important team players in our pathology workflow. We as a trainee not only learn from them how to grow, but also through the interaction, we sort of learn how to correlate the growth findings with the microscopic findings, which is very important for us to develop our diagnostic skills. In that context, I'd like to ask the number of PAs in our program and how the PAs would, for example, help the PGY1 resident to start with the grossing. That is my question. So through this example, I think we sort of provide a context of why we want to understand the number of PA in the program, and also we shared our thoughts. We sort of show that we understand that PA are important team players in pathology, and we show our understanding that we actually learn from PAs during residency. And also the last one I want to mention is to try to show our efforts. For example, you happen to know someone in the program and you have reached out to them to talk about the program. And you may want to mention when you ask a question like, before the interview, I also reached out to Dr. A. We talked about the grossing organization in the program and learned how invested our PAs are in teaching new residents. I think that is another strategy to show that we are making effort to seek connections and try to learn about the program in different ways. And that shows our serious interest in the program. So I think these are what I would like to cover for this video. As a quick summary, we want to have a reflection about what to ask and whom to ask, and the ways that can help us to ask in a better way. So thank you very much. I hope this video helps. I'll see you in the next video. Thank you.